first of all, it's we have a patient in an appropriate position and they've been ventilated. So again, a bit like intubation, we would do 30 seconds of good ventilations, because when we stop ventilating to carry out the procedure, the patient's not breathing.
Yeah.
So, that. So while I'm doing that, what I want to do is open up the LMA packaging, but leave the LMA inside the plastic. But for an LMA, it's a weight adjusted size guide. So this is a size 4 for an adult, 50 to 70 kilograms.
Okay.
So it's appropriate size.
Yeah, would I show you the packaging for that?
Yeah, that's fine, absolutely. Like every time we use something that is sized to a patient, we would normally have the size below and the size above as well.
Okay.
But for this one, for this Airway mannequin, size 4 should be fine. So once we've got the that opened, it's about preparation for it. So we take it out, we extract the air out it with the syringe, lubricate it and insert it into the patient, then reinflate the cuff so that it forms a seal around the top of the esophagus. Once we have confirmation that that's in place, then it's just a case of applying the Thomas tube holder onto the ET tube, securing it in place, and then continue to ventilate the patient.
Okay.
Happy with that?
Who's going to be doing when I've got this open? Who's going to be removing the air from it? And
I'll do that. So if we swap over, so I'll start ventilation. Just explain a little bit about ventilation. When I stop that, you can take over ventilation. I'll prep the airway.
Okay.
And then you can do that. Happy with that?
Yep.
Okay, so because again this is a procedure that's going to involve me putting my fingers in the patient's mouth, I'm going to do hand hygiene with some alcohol gel and put a pair of gloves on, because it does involve me inserting my fingers into the patient's mouth. So with gloves on, we again have the patient in a good head position, head to chin lift, nice C-shaped grip, ventilating, chest rise and fall during that procedure. Okay, happy with that? You happy just to take over for that?
yeah, sure.
Okay. So, to prepare the LMA, it's weight adjusted, so that's a size 4 for an adult, 40 to 50 kilograms. Quite happy with that.
Yep.
Inside the package, when we open it up, we want to keep it on a clean surface. Okay. When we take the LMA out, it's got a plastic cover on it, and it will be discarded. Our first stage of preparation is to extract the air out the cuff. So we lay it back down on the clean surface, and with a 50 ml syringe attached to the pilot cuff, to the pilot bulb, with a little bit of pressure at the back of the LMA, all we want to do is extract the air until the cuff flattens out. So it's a nice flat surface on the cuff. Next thing we need to do is lubricate it. So with a little bit of lubricant gel, just a tiny amount of lubricant on a piece of gauze. We lubricate the back surface, and that's the flat surface, not the side with the hole. So a little bit of lubricant on there just to help it slide into the airway. Okay, so to insert it, we hold it like a pencil with our finger in at the junction of the tube, the pilot cuff, in there, so that we can insert it. We're going to apply some force against the palate and slide it. Okay, it's fine, just step away from me. Thank you. So, again, nice head position, bringing the LMA in towards the patient's mouth behind the teeth. We're going to keep pushing and applying force and pressure and slide the LMA down into position. Okay. Once I'm happy that that's in position, I can see that the patient's teeth are in between the two bite markers. I'm going to inflate it. It tells me in the package how much air I need to put in, so up to 30 mils of air. Also tells me in the pilot cuff how much to put in. And I've seen the tube rise up, so I know it's in the right position. I'm happy that that's in position. With the bag valve mask, with the mask part taken off, I can connect. I can see chest rise and fall. Again, just to confirm, I'm going to listen for air entry through the lung fields, and just listen to make sure the stomach's nice and silent. Okay, so I can continue ventilating the patient if you want to put the Thomas tube holder on. So I can continue ventilating to an appropriate rate. fine. So the tube holder goes on with the opening facing down towards the patient's feet. So I'm just going to bite box in position, good. Let's pull that all the way through. That's it. Okay, so I'm happy that that's in position. I'm going to move the pilot cuff out into the opening so it's not getting squashed. Happy that the tube holder's got it in position, but I'm just going to confirm again, just because there's potential for displacement. So apex, apex, mid-axilla, base, base, and finally on the stomach. So I'm happy that that's in position. And if we're moving the patient, say we're moving them on an orthopaedic stretcher, I could consider putting a collar on to stop the head rotating on the orthopaedic stretcher, which